Hello there, I'm Nurse Sally. Thank you for coming today. I'm assuming you know what's involved, but I'm just going to tell you just in case. Today I am going to be doing an extreme medical examination on you, which includes a skin check, a lice check, eyes, ears, and a mini cranial nerve test. Nothing too serious, okay? If you were interested in booking a full cranial nerve examination, then you can always do so after this appointment today, okay? But for today we're going to be doing quite express checks, but all in one, alright? So I'm first going to check your scalp and also check for any lice. Do I have permission to do so? Okay, good. So I'm just going to put my gloves on, and I'm going to be as gentle as I can. I hope you're not too sensitive to the scalp. Okay, good. Like I said, this isn't going to be too long because we have a lot to go through, but I will be as thorough as I can for the space of time that we have today. Alright, so what I'm going to do first is I'm actually going to spray some spray in your hair just to make sure that it is not too knotty when I go through it, okay? Okay, good. Alright, let's let that set in for a minute. It does smell good, doesn't it? Alright, let's have a look. I'm first going to look with a light and a magnifying glass, okay? I'm just using the light to go through your hair a little bit. This is a special light that actually can highlight any lice in there, so I will not miss anything. It makes my job a lot easier when I'm doing this, for definite. Okay, let me just say, I'm just going to be coming up behind you now. Alright. Good. I'm also checking that your scalp is in good condition, that you haven't got any dandruff or anything like that, okay? Which naturally most people do have a slight bit of dandruff here and there, but if we see big flakes and redness to the scalp, it could be a sign that you have psoriasis of the scalp. Okay, I'm just going to squeeze around here to this side of you. Alright, and I'm just going to have a look over here, just on this side as well. Alright, don't worry, no one can see from behind the curtain, it's quite private. I know. Are you comfortable? Good. Alright. Okay. You have got a little bit of dry skin here, which I could apply some ointment to. Let me just get that, and I will apply it to your scalp, okay? Alright, this is just a special serum, okay? Just rubbing it in there for you, okay? It has a slight massage roller on the end that it will really get into your scalp. Alright. Okay. All in all, your scalp doesn't actually look too bad at all. I do not see any sign of any sort of lice in there, or eggs. Usually if there is eggs, there's lice. and vice versa. And I don't seem to see any of that there. Okay. Okay, I do apologise for walking around you like this. It's a little bit tight in this cubicle, I'm really sorry. My main room I have is taken up by another patient and another doctor, so unfortunately you've got the small room today. Alright, so I think we'll move on to the next check because everything looks perfectly good in your scalp, and overall the condition of your head is perfect. I can also give you that roller to take home with you if you would like to apply it to your hair some more. That's fine. Alright, so let's see. Next we shall do, what shall we do next? Let me just take a few little notes first just to make sure I keep up with the results of today. Okay, let's have a look. So we have done your eyes, all clear. Slight dry skin on the right side, but nothing too major. Okay, good. Alright, that's good. Alright, next I'm going to be checking your ears. This really is, it's a bit of a process in how long I have to spend on them, just looking at them. I will be kind of tugging at them and looking deep inside of them. I'm going to try not to talk too much because obviously I will be right close to your ears, so I don't want to disturb it too much. Let me just get my earpiece. Okay, and I'll pop that on there. Alright, that's okay, that's done. Okay, so let's begin on your ears, okay? So I'm just going to start by looking in your ear first. Let me move your hair. Have you had any tenderness in your ear? Just a little bit of an ache, yes. Okay. I can see that you have got a little redness in there. How long have you had this tenderness for? About 2 weeks? Okay. Maybe this is what you're feeling at the minute, and this is why you've booked your appointment today. I think you may have a slight ear infection. Okay. Right, let's see, that's that. Alright. Do you mind if I have a look at the other side? Alright, let me just squeeze past you again, I'm so sorry. Okay, that's it, that's it. Okay, let me just move your hair out of the way as well, sorry. You ready? Okay. This ear does look slightly better, but still has a little redness in there. did you hear? Sorry, did you feel the same symptoms in both ears at the same time? Okay. Yeah. Let's see that, yeah. Okay. I do think we're going to have to give you something for that. It looks pretty nasty, actually. Do you mind if I look one more time? This side looks slightly worse than the other, but they luckily will respond well to both sides if I give you treatment today. Okay. I'm just going to turn you slightly, okay. Let me just look at this one again. Ready? Okay. Yes, definitely need to give you some treatment, unfortunately, but fortunately you've come today, because if you left that any longer, I'm sure it would have got worse. Okay, it's important if you feel any sort of symptoms to get in touch with your medical professional straight away, okay? I do apologise, it's very hot today. I'm sweating. I know, it's horrendous, isn't it, this heat? Never mind, I guess we'd complain if it was raining too, so. Okay, let me just put some notes down first and then we'll move on. So I'm going to need treatment for both of you. I'm going to put you on a 2-week course, okay, of antibiotics. That will clear up in no time, I promise you, but if it does feel better before you end the course, make sure you finish it, please. Do not stop halfway through. Okay, good. Alright. Right, so I think next I will check your eyes, your vision. Alright. So I'm going to get you to do a few things for me. So are you ready for that? Yes? Good. Okay. I want to begin with my pen light here, and I just want you to follow the light. Good. Keep following it. Okay, and then if you'd just like to look straight forward, I'm going to do the same thing, but you just do not move your eyes. Alright. No matter how close I come to you, do not move your eyes. Okay. Okay, good. Okay, good. Okay. Alright, good. Yes, alright. With this I am going to be getting quite close to you through the eye examination, okay? I know it can be a bit uncomfortable, but please bear with me. Okay, so I'm going to just slightly turn you to me, and if you could look at my nose, please. Alright, just look here. Alright, good. Okay, good. Look here, please. Very well. Good. Keep looking at my nose. If I move, you move with my nose. Good. Follow it. Well done. Alright, I'm going to stop shining that torch in your eye for a second. And I'm just going to do some check on you, okay? So I have a few different coloured lenses here. I want you to tell me which one you can see through better. Alright, so can you see through this one better? Oh, this one better. This one or this one? This one or this one? Okay, good. Can you see through this one better? This one, this one? Good. Alright. Interesting. This one or this one? This one or this one? Okay, good. And again, one more time. Can you see through this one or this one better? This one or this one? This one or this one? This one? Okay, that's very interesting. Alright, let me just try something on you. Can you see with these on? You can? Better? Yes? Okay, good, good. Alright, let's see. Can I just try these on you? I'm just going to do a few little measurements, okay? I'm just going to do something else for measuring your eyes, okay? Okay, good. Yes? Good. Right. And lastly, I'm going to look in your eye really closely now, okay? So just please try not to blink. Okay, good. Okay. And I'm just going to go on this side here. Okay, just keep still, please, keep still. Okay, I'm going to look at this side. Okay, good. Alright, I'm just going to come to this side of you again, sorry. Oh, I do apologise. And then, let's see this bit here. That's good. Okay. Sorry, I have to get so close to you. Okay, alright. That looks good. So I think I might, if you would like to try some coloured lenses, this actually might help your vision quite a lot. I don't think there's anything wrong with your vision as such, but I just think coloured lenses might just help you out, alright, overall. Yes, sometimes with certain things we find it easier with coloured layers on our glasses rather than actual prescription glasses, and I think that's the case for you. Okay, so I'm happy to give you them at the end of this, so I'll also give you that. Okay, alright, good. Okay, so next I'm going to be giving you a skin examination where I will be looking closely at your skin through a magnifying glass like I did with your scalp, and I'm just going to be looking for any sort of imperfections or any rashes, any moles, anything out of the ordinary basically. Do you suffer from any skin conditions? You don't? Okay, not that you're aware of. Okay, that's fine. Alright, well, let's have a look. So I will get my tools out and we'll begin. So what I'm going to do is I'm going to examine your face first, then your chest, and then I'm going to get you to turn around and I will have a look at your back, okay? Right, is that okay? Good, alright, let's see then. Let me just get out a few things. that. I'm also going to be doing a few little swabs if I need to, so be prepared for that, okay? Alright, so let's begin. Alright, so I'm going to do your skin first. I do apologise, all my lights seem to be playing up today. Alright. Okay, good. Again, I'm going to be getting quite close to you. Let's have a look down here. Do you find you get any reactions with certain jewellery that you wear? No? Okay, you're generally quite okay. Right, that's good. Some people are very sensitive to certain jewellery, so I just wanted to see if you'd experienced that before. Alright, let's see. My pen light does not want to work today. Okay, so that's that. You have very good skin, to be honest. Really good skin. Let me just move this aside. Right. Good. Okay. That's okay. Alright, I'm going to turn you around, alright? And I'm going to have a look at your back, if that is okay with you. Alright, let's see. I just need to see a section of your back, not the whole thing, so that's okay. Little freckle here. I mean, I know you don't get to see your back. Let me try another light, I think. Where have I put it? It's here. Okay. I'm just going to try a different light because that one just doesn't want to work. That's better. Okay. Let's see, we'll try again. Ah, that is much, much better. Wow. Okay, I'm going to shine this down here. A little redness on here as well. I'm just going to move your necklace slightly out of the way a second. Alright. And another little freckle here, but it's just a freckle, it's not a mole. That's quite normal. Okay. Alright, what I'm going to do is I'm just going to do a quick little spray on your back. I'm going to give it a minute and then I'm going to see if you have any reactions. It's just a minor little thing, so if you do have a reaction it will not do much harm at all, but I'll give you a little red spot. Alright, so I'm going to let that sit on there for a second. Okay, that's sitting there. I might just spread it around a little bit. Just spread it into the skin. Okay, there we go. Alright, good. Alright, good. Okay. What I'm going to do next is I'm just going to keep some swabs in there, and these have different allergens on them. Okay, and I'll try this one too. Okay, that's good. And then what I need to do is I just need to let me go and dry that off for you. I will get you to turn around in a second, okay? Get some tissue to dry that off, okay? Alright, okay, that's good. I do not know what's wrong with my lights today. I apologise. As far as I can see, there doesn't seem to be any reaction whatsoever, which is good. That's what I like to see. Alright, well, I'm going to just put your shirt back on now. I'm just going to put your shirt on there. I'm going to get you to turn back around if that's okay. Alright, and then we're going to finish off the examination with one more slight little test, but it's nothing too strenuous. I do need you to do a little bit more though, if that's okay. Let me just get a tissue for my face. It's very hot in here today. Okay, so what I'm going to do is I'm just going to put my hands on your shoulders, and I just want you to shrug them off as much as you can. So if I push down, you shrug them. Good. Alright, and then I'm just going to push back. You have to push forward with your shoulder. Good, and this side as well. Good. Alright, now I'm just going to hold your chin, and I just want you to try and open your mouth. Okay, good. And then just open your mouth again. Okay, that feels good. Have you ever had any clicking of the jaw when you do that before? No, alright. So next I just want you to smile for me. Alright, very good. And I'm just going to do a test, and I want you to tell me if it is sharp or soft. Alright, and I'm going to behind my toes. Okay, where's it? It's here, I think. There we go. Okay, and I just want you, I tell you what, I will, can I find my blindfold anywhere? I did have my blindfold somewhere, but I don't know where I have put it. Let me have a look. Here, my drawers. No. Okay, if I can't find it, I'm just going to have to get you to close your eyes. I tell you what, I think it might be down here. Is it? No, it's not. Never mind. No. No. Alright. I'm going to cover your eyes, okay? And I want you to tell me if it is blunt or soft, okay? Good. 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 I'm just going to do it down here. You can close your eyes still. Good. 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 Okay, good. Very good. Alright, and I'm just going to do it on your ears now, okay? So if you can tell me which is which, that would be great. Good. Good. Alright, and the other side. Good. 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 Alright, well done. Well done, well done. Alright. Okay, and how is your sense of smell? Alright, okay, so I've got 2 candles here. I want you to smell them both and tell me what flavours they are or scents. Alright, so if you can smell that. Can you tell me the scent? Good, well done. And I have one over here. Can you tell me the scent? Good, well done. I'm very impressed. They weren't easy scents, to be honest, but you got it. Alright, well, let me just take a few notes and we'll round up, okay? Alright. I'm just going to take my gloves off for a minute because, like I say, it is very, very hot today and my hands are sweaty. They're very sweaty. It's quite gross. Okay. Okay. Alright, I'm just gonna highlight a few things on here for you, just to go away and do some research for yourself. Okay, so the pink highlighter means that you can find it on the internet. The green highlighter is where you can book to see specialists, okay? Do talk about these things. Alright, I'm going to give you a pair of yellow tinted glasses today. And also I will give you the roller so that you can massage your skin, okay, and your scalp. That should treat the dry skin that you're experiencing over here, okay? And then you should be good as new, alright? So I want to thank you for coming today. And well, it's getting late out there, so I really want to wish you